Hi friends. Now I know AIMS exam for this session is over, and I know that you might have done well, you may not have done well. These are all possibilities in your mind, and all those possibilities that are going on in your mind, that I should have marked that question right, I should have done this question right, and all that is kind of creating that post after effect of the exam. But my duty here on this YouTube channel today is to tell you that please do not forget there is one more Central Institute exam coming up called as PGI Chandigarh. So PGI Chandigarh is an institute as good as AIMS. In some specialties, it is considered even better than AIMS for some specialties. Some specialties, AIMS is considered better. They are at par. At par. So when you're looking at an institute which is Central Institute, at par institute is an opportunity for you. And traditionally, PGI Chandigarh was done as a paper-based test in Chandigarh only. This is the first time where they are doing paper in multiple cities. So I want you to look at it as an opportunity. Now the exam is coming closer to your city. Why don't you give it? It's a good idea now to target this exam, and in the next 10 odd days, if you play your cards right, if you make a good strategy, you can hit this exam hard and you can get into an institute similar to AIMS, instead of putting your time into thinking, oh my god, I did not do this, because you cannot roll back clock. The problem with time is that you cannot go back and do the thing right, but you can do it better in the next exam. So it is very, very important for you to consider PGI Chandigarh as an opportunity right now and start working in those directions. But how to make a strategy for the final 10 days for PGI? I will keep it very simple, very common sense for you, because I believe that nothing beats common sense, nothing beats mathematics. I'll show you mathematics now. This is how the subject-wise distribution of this exam is as per the prospectus of the exam. I have highlighted for you a small statistics which will immediately tell you what to put your time on in the final 10 days. Look at the first prop subjects. They are saying there will be 6 questions from applied anatomy, 6 questions from applied physiology, 12 from applied biochemistry, 10 from molecular biology. That makes 22 from biochemistry, molecular biology, all that put together 22. So if I have to put my money, my time on, I would say let's revise biochemistry more. Let's look at the class notes of biochemistry in the end. That is a good short thing. It's going to have 22 questions from biochemistry. Second thing that I want you to look at is the core clinical subjects: medicine, surgery, obs and gynae. Look at that, 36, 36, 20. So out of 250 questions in total, you have 70 to 92 questions. 92 questions from medicine, surgery and obs and gynae. That makes sense. 92 plus 22. 22 from biochemistry. That makes it 94 plus 20, 114. Okay. So you can see almost half of the paper is there, and you add to it pathology, 15 questions. Now, I feel if I have to bet my final 5 days and say, okay, what should I do which would help me make a mark in PGI Chandigarh? I'd say, let's do biochemistry, let's do pathology, let's do medicine, let's do surgery, let's do obs and gynae. I do them at very well in my revision in this for this final session of revision. Then I want you to look at 4 more subjects in this distribution, which is telling you something interesting. Look at pediatrics, look at radiology, 12 question. Classically, these are shorter subjects. You have a small notebook with you. You can actually look at them very fast, and they are yielding 12 question each, which makes it very interesting to look at. And pharmacology, microbiology, 12 question each. This is where at the most I would put my extensive revision cycle into. This is where I would have my priorities set. Core clinical subjects, medicine, surgery, obs and gynae are very important. In short subjects, radiology, pediatrics would be more important. In basic sciences, biochemistry would take the preference, and in the paraclinicals, I'll put pathology, then microbiology and pharmacology there. This is how the marks distribution spells out for you. So I hope this gives you an insight where to put your time on, because that is the key. You can't ignore the distribution. So this is very different from AIMS. In AIMS you had a good number of questions on anatomy. Here you're looking at, they're saying only 6. So you have to come out of that shell that, okay, this was a different exam. PGI Chandigarh is a totally different exam. But the institute is very good. It's a good opportunity. I would not miss it for anything. Anything. I would not miss it. Let's take my chance. Okay, that's the key. What else you should know about the exam that you're approaching? Number one is that PGI Chandigarh is a knowledge intensive branch. Here, because you have 250 questions with 5 choices, the entire paper would test you a lot. Often when I meet students who come out of a PGI Chandigarh exam, they would say, sir, they tested my entire MBBS knowledge. Okay, so because if they give you a question on a disease like say sarcoidosis, there will be a question on the something to do with etiopathogenesis, something to do with some epidemiology, something to do with treatment, something to do with complications. So all those will be the choices. So it is important to notice that they would test you about the well-rounded understanding of a subject, not just you don't have to pick out the single best answer, you need to pick out all the correct answers. When you're looking at such an exam, class notes become more important because you want a more well-rounded understanding. But just in case you're on shortage of time and you want to make a strategy for these 10 days, I would focus on the high yield subjects for class notes here. Okay, like those clinicals, and I explained to you the biochemistry, and this is where pathology, this would be the key. Second key is previous papers. When you log into your eMedicos app today, you will be able to see there are video discussions on May 2019 paper, 2018 papers. There is a video discussion on 2017 paper also. Please look at them. And whenever you listen to a video discussion, keep a copy with you. I'll tell you the reason. The reason is in PGI Chandigarh, they would repeat questions. But often, even more important than the questions, sometimes they repeat topics. So what I would do if I was in your place, I'll say, okay, I'll stick to the major high yielding subjects. I'll listen to the previous year papers. And whenever a teacher is saying about a topic and I feel this topic is important, this was there in 2017 also, 18 video also, 19 video also, I will write it down. And those topics, I'll go back to the notes and find, I'll do a little bit check around those topics again. Okay, just the topics. Any topic that you feel was there in the video that teachers are discussing with you in 2017, 2018, 2019, it's a good idea to look at them. Okay, so this topic repeat and your class notes and the high yield subjects, this forms the core of your strategy. What else? This is the first time they're doing a computer-based test. And I have seen in the past any exam that transitions from a paper-based test to a computer-based test, it introduces an element of a visual. Okay. So far, when you look at the 10-year papers in PGI Chandigarh, there has never been a visual question in the exam. Okay. But now the paper is transitioning from a paper-based test to a computer-based test. You never know. Okay, but I cannot bet too much on it because the entire paper is already bent towards the clinical questions, medicine, surgery, and obs and gynae. So if I have to think, okay, what kind of visuals they would put, it has to be clinical visual ever, but you never know because anatomy, they have, reduced the weightage, the anatomy is only 6 marks, physiology is 6 marks. So what else can contribute to visual? Again, we come back to the same subjects, pathology, radiology, and clinicals. So anyhow, when you're revising them, you're brushing up what visuals we have discussed in a routine class, but don't go overboard on them because they have never asked a visual in PGI in the past, but this is the first time they are making a CBT. So that would be a sensible thing to keep in mind, just to keep in mind so that you don't get surprised. You know it already, you've been preparing for it, you prepared for visual even for AIMS exam, so don't be scared of the visuals. Okay, second thing is, in PGI Chandigarh, there will be more than one answer correct. But do not forget, there will be questions where only one answer will be there. Okay, I've seen in the past that there are questions where only one answer is there. So it's okay. So you have to find out in the paper, then what answer do you feel is the correct answer. If you feel only one is correct, it is okay, please mark one only. It's like if you feel 2 are correct, 3 are correct, it is possible that so do not be in a frame set that every question will have more than one answer correct. There will be questions where only one will be correct, but the paper says each question can have more than one answer correct. I'll explain to you, and that introduces to you a problem of time management. There are 250 questions, 5 choices each, that makes it 1250 choices. That means you have to read 1250 statements in 3 hours. Okay, it takes time. So the entire model here is, and you felt this in AIMS exam also. I can hear you, saying yes to it. That some of you must have felt it in AIMS exam also, where the paper said 200 question, but the actual question palette had 288, and you felt the pain of completing the paper. So please be from the word go, start doing it at a uniform pace. Don't do like this, first 1 hour only 20 questions, last 1 hour I will do everything. No. You have to go fast from the word go. It's a good idea to, please go through the e-medico's previous papers so that you are in a mindset of thinking for PGI. Start fast at the word go. If I divide 250 questions into 3 hours, usually it comes to around 40 to 50 questions per half an hour. Okay, that should be your target in mind, maybe 40 per half an hour. That leads you to, into 6, it would lead to 40, 50 would lead to 300. So you need to kind of plan it accordingly. But do not be slower than that. You can't be doing 20 questions in a half an hour. You have to divide it accordingly. So you have 3 hours, 250 questions. Okay, divide this 250 by 3 or by 6 and recheck at that interval. Okay, so in my case, I always recheck at 30 minutes interval. Where am I? Am I at the correct frame? Because if you don't finish the paper, you are causing trouble for yourself. You need to finish it. It will take time. You need to go uniformly fast at the word go. But what prevents you from going fast is, okay, I want to dwell upon it. And today, I know many of the candidates would understand me better today. When you appear for an exam, the key skill in an MCQ exam where the questions are more is decisiveness. I'll tell you decisiveness means, sir, I think the answer is A, but I don't know what to do. Okay, I'll go to question number 2, then decide, and I come back and no. You have to learn the art of decisiveness. If you think the answer is B, let's do it, and then go on to next question. But the entire, the concept of overthinking first half an hour kills the time management. You need to learn to be decisive about what you want to do. Later on, the same decisiveness will help you in life also. That if you would be in a, you're going to be a doctor who's going to perform a lot of, you have to take a lot of decisions. You can't just linger on everything. Sometimes you have to take decisions. Yes, an MCQ exam needs you to take decisions. And those decisiveness should start from the word go. Do not keep that thing that first 1 hour I will think so much in the one, you have to know that, okay, this is the answer. But do not forget, in PGI Chandigarh, there is a problem with negative marking. The negative marking means that approximately comes to plus minus 1. That means if you mark a wrong choice right, then you get a negative mark. Okay, so how would this is different from AIMS. AIMS, you had predominant questions with 1 by 3 negative marking. PGI, the predominant questions have 100% negative marking. So what would I do if I was in your place? I'll give you an idea. Okay, if I know that B is the answer, I'll definitely do it. If there is a choice saying C and my gut feeling says this is correct, I will go for it. But I will not do any blind guesses in this exam. No blind guesses. If you feel you do not know it, leave it. Okay, so I'm again repeating, if you know it, definitely go for it. If my gut feeling says, I will. But I will not do any blind guesses in this exam because the negative marking is at a high penalty level. If I don't utilize this negative marking, if I mess it up, I'll be out of the race. You can't mess it up here because we are looking at a almost equal negative positive ratio, which is calculated by a very complex formula. Number of actual rights, number of rights you have done, then number of actual wrongs and number of wrongs that you marked. They calculate it. But this is what it roughly comes down to. A high negative ratio. For an average candidate, it comes out to be approximately same positive and negative. So I would not do any blind guesses here. If I don't know it, I'll leave it. If I know it, I'll do it. If I have a gut feeling, I'll still do it because I've been working hard for the entire year. Probably, if you feel that you are a good candidate, you feel central institutes are meant for you, you have to take some chances, but not too many chances because the negative marking is very severe here. Okay, so these are the things to keep in mind. And finally, I also want you to know that you have to keep this optimism alive. The optimism means be positive about the outcome, be positive about where you will reach in life. You have come so far. You are already a doctor. It's not an ordinary feat. You have come so far. So that means there must be something planned by the, somebody high above you who must have planned it for you, that you one day this boy would reach here or this girl would reach here and do this big thing in world. So have that optimism alive. It doesn't matter, because that is the reason why you have multiple exams. That okay, maybe my AIMS exam did not go well, but why not PGI Chandigarh? Let's maybe this is the reason why they decided to do it computer based. Maybe it is for you. They are bringing the exam closer to your city. Why not? Go for it with optimism. I also want you to remember every exam is an opportunity. The reason I'm telling you this is because a lot of students are sending me messages. Sir, should I waste one day giving the exam? Why not, study some topic? No. Please see, every exam is an opportunity. It's a good idea to give the exam. It's an opportunity. It's a gateway. It is a ticket to post graduation in one of the prime institutes in the country. Why don't you take that opportunity? What is stopping you? So this exam is an opportunity which you will go for with full optimism. Please do not miss any gateway that opens in your path in your life. You never know which gate is meant for you. This is the next exam coming up, and I want you to focus your entire strategy on this exam. I wish you all the best for your upcoming PGI exam, and I wish you all the best for your upcoming AIMS results as well. I wish you all the best. Thank you.